name is Dr. Bruce Cotugno. I'm a neurologist here at the Washington Health System. I've been in practice here almost 35 years, and I treat a variety of neurologic conditions, including stroke, epilepsy, headache, and neuromuscular disorders. May is National Stroke Awareness Month, and I'd like to take a little time to discuss stroke risk factors, and B.E.F.A.S.T, and know to see the warning signs of stroke. A stroke is an area of brain that has loss of blood supply, so it's an area of dead brain tissue. I like to think about heart attacks. Everybody understands heart attacks, that when people have a heart attack, a piece of their heart dies. Same thing with a stroke. A piece of their brain dies, and it dies from lack of blood flow. And it could be from a blocked artery, an artery that burst, and the artery can occur anywhere, in the neck, in the brain, or even an embolus that can occur from the heart. Well, the warning signs of a stroke, we like to give a mnemonic, and it's B.E.F.A.S.T. So we start with B is balance. So people can feel off balance, that they're being swayed to one side, either the right or to the left as they're pushed or they're leaning. They can have headache, they can have dizziness. Dizziness could either be unsteadiness or vertigo. That's the B. E is eyes, that people have some blurring of their vision, loss of their vision, and people can have loss of vision in one eye or their visual field. So when people say, I can't see out of my right side, that can be they can't see out of their right eye, or they can't see out of both eyes in the right side of their visual field. And FAST is F, face. So people see a droop to their face, facial droop, which could lead to slurred speech. A is arms, so weakness. So someone will tell you that my arm feels very heavy, they can't lift their arm, it'll just fall to their side, their arm is dead, numb. S is speech, as we mentioned. That speech can be slurred, that from the facial droop, or you can lose your speech, that you can't express yourself. Patients will say, I know what I want to say, but I just can't say it, or they just don't understand what they're hearing. So T is time, which means you want to act quickly. You want to get to the hospital quickly, call 911. You want to get to the hospital within 3 hours, because there are things they can do actively to stop the stroke in progress and hopefully reverse some of the effects of stroke. So we want to get to the hospital within 3 hours, where they can give them medication such as TPA, to reverse some of those symptoms. Now they're fairly similar. The stroke symptoms, everybody's stroke might be a little bit different. Some person's stroke, their arm may be weaker, someone their leg may be weaker. Some people have just visual symptoms, some people just have speech symptoms. But stroke symptoms among men and women are fairly equal. It's important to see emergency medical treatment because A, you want to be stabilized, you want to make sure your blood pressure is controlled, your blood pressure is not too high, not too low, checking your circulation and your respirations. Getting to the emergency department, all those things can be checked. In addition, they'll do a brain scan, they'll check you for any brain bleeding, signs of brain swelling. And if you get to the emergency department fast enough and you meet these criteria, you can get a clot-busting drug called TPA. We call it a clot-busting drug because the clot is in the artery and want to be able to dissolve that clot with this medication. If we can dissolve that clot, we can restore blood flow and reduce some of the effects of the stroke and hopefully reverse some of the symptoms of the stroke.
I'm Toni Behanna. I'm the nurse manager of B.E.F.A.S.T South, which is one of our dedicated stroke units, and I'm the stroke coordinator for the Washington Health System. We here at the hospital have a great stroke program. It makes us a little bit different. We have been awarded with the Get With a Guidelines Gold Stroke Plus Award for the last 11 years in a row, which that shows our commitment to the clinical practice guidelines and actually the evidence-based research to provide great stroke care to our patients here. So with the Get With the Guidelines, we have a lot of quality metrics that we must meet, and being 11 years in a row, we have held that standard for 75% or greater of all of our metrics for in a year past for those data. So our staff here at the hospital, we have 2 dedicated stroke units, so both 5S and 6S, and our staff are specifically trained with stroke. So they go through specific programs and education related to stroke. They go through the NIH stroke scale, so they are certified annually with that. We use the Yale swallowing screen here, and they are all trained in that also, so we can make sure that our patients are safe to swallow. The stroke program here at the Washington Health System is really great. This has been my program for the last 11 years, and it's been my baby. So I know that if somebody in my family or one of my friends or myself was having a stroke, I would want to go to Washington Health System. We provide great patient care, and we work really hard and well together to provide that. If anybody in your family, friend, whoever it might be, is experiencing any of the stroke symptoms, just please remember the B.E.F.A.S.T, the balance, the eyes, face, arms, speech, and time. Most important time is get to the hospital right away. For more information for stroke, you can go to WHS.org.